Hello, good evening everyone. Welcome to OET Speaking Speculation. This is me, Richard Caroline, joining you from Neethu's Academy. So this is yet another Tuesday. I'm here with you guys at 5:30 p.m. to discuss another exam module card for you guys. So yes, I hope all of you are staying safe and healthy and you're preparing well as well. So I hope you guys are, the next exam that we have is on June 28th. So I hope all of you are preparing well and good enough to do the exam on June 28th for those who are taking the exam on that date. Okay, so yes, let me know in the comment section if anyone is planning to write the exam on June 28th. Okay, so I'll understand who are the exam takers and when you're planning to write the exam also, so it will give me an idea about what are the points I can add on to help you to improve your speaking or also to improve the strategies that you can implement in your learning curve as well. So yes, good evening all of you. So ഇന്ന് നമ്മൾ ഡിസ്കസ് ചെയ്യാൻ പോകുന്ന ഒരു സർജിക്കൽ വാർഡ് സെറ്റിംഗ് ആണ് ആൻഡ് ഈ സർജിക്കൽ വാർഡ് സെറ്റിംഗിൽ ദ പാറ്റേൺ ക്യാൻ ബി കൈൻഡ് ഓഫ് ലൈക്ക് സിമിലർ യു മൈറ്റ് ബി ഫെമിലിയർ വിത്ത് ദിസ് കോണ്ടെക്സ്റ്റ് ബട്ട് ആസ് ഐ ടോൾഡ് യു ഇൻ ദ ലാസ്റ്റ് കപ്പിൾ ഓഫ് വീക്സ് നമ്മൾ ലൈവ് ചെയ്ത സമയത്ത് ഞാൻ നിങ്ങളുടെ അടുത്ത് പറഞ്ഞിട്ടുണ്ടായിരുന്നു പാറ്റേൺസ് ആർ കൈൻഡ് ഓഫ് ലൈക്ക് റിപ്പീറ്റിംഗ് നിങ്ങൾ നോക്കുകയാണെങ്കിൽ ടോപ്പിക്സുകളൊക്കെ ഒത്തിരി തന്നെ റിപ്പീറ്റ് ചെയ്ത് വരുന്ന മോഡലിൽ വരുന്നുണ്ട് അതിൽ തന്നെ ഐ എം നോട്ട് ടോക്കിംഗ് അബൌട്ട് ദ എക്സാക്ട് കോണ്ടെക്സ്റ്റ് എന്നുള്ളതല്ല അതിൻ്റെ ടാസ്കിൻ്റെ ഒരു നേച്ചർ ആയിക്കോട്ടെ ടാസ്കിൻ്റെ ഒരു കോണ്ടെക്സ്റ്റ് അതിൻ്റെ ഒരു പാറ്റേൺ ഇറ്റ് ഈസ് റിപ്പീറ്റിംഗ് അത് നമ്മൾ പിന്നെയും ആ ഒരു ഓർഡറിൽ അല്ലെങ്കിൽ ആ ഒരു ടെക്നിക്കിൽ തന്നെ പിന്നെയും റിപ്പീറ്റഡ് ആയിട്ട് വരുന്നുണ്ട് സോ വെൻ യു പ്രാക്ടീസ് മോർ ഓഫ് ദീസ് ടൈപ്സ് ഓഫ് കാർഡ്സ് ആൻഡ് വെൻ ദാറ്റ് ഈസ് ദ കൈൻഡ് ഓഫ് എ ട്രെൻഡ് it will be easier for you to perform when you're doing the role play. Understood? അപ്പോൾ നിങ്ങളത് ചെയ്യുന്ന സമയത്ത് ഈ ഒരു പ്രാക്ടീസ് സെഗ്മെൻറ്റ് നിങ്ങൾ ചെയ്യുന്നത് കൊണ്ട് അല്ലെങ്കിൽ കോൺസ്റ്റൻ്റ് ആയിട്ട് ഇതുപോലത്തെ കാർഡുകൾ പ്രിപ്പയർ ചെയ്യുന്നത് കൊണ്ട് തന്നെ നിങ്ങൾക്ക് പ്രസൻറ്റ് ചെയ്യുമ്പോൾ വലിയ ബുദ്ധിമുട്ടുണ്ടാവില്ല. Okay, so that is one of the cards that we are going to do today. And also, let me tell you one more point. I've been getting some requests from non-Malayalis to do the entire session in English. So I would be talking more in Malayalam, but you won't be missing out on anything because whatever I explain in Malayalam would be the same thing that I explain in English. And it would sound like I'm talking for a long time in Malayalam because I'm explaining more about it in detail. Okay? Maybe I'm giving an example or anything like that, but I'll make sure that I'm not giving anything extra in that language. I'll be always making sure to say the same thing in English as well. So if you're a non-Malayali who is watching the session, don't worry about it because I've been getting constant requests from a lot of non-Malayalis to only speak in English. Okay, sometimes you'll have to stick on to the colloquial language. So it happens. So if you are a non-Malayali watching the session, please don't worry, you will not be missing out on anything. I'll be ensuring to say the exact same thing in English as well. Okay, so if you hear me talking in any gigantic terms, don't worry about it. Okay, so it's just a heads up so that you will have an idea and you can keep that in mind. Okay, yes, so having said that, let me give an overview about the card that we are going to do today. So it's a surgical ward setting and the patient had a gallbladder removal yesterday and you're meeting the patient in the ward. So technically you will be telling the patient why you are there, to check the progress, blah blah blah, all those information, and after that you are reassuring the patient regarding the surgery, like okay, how the surgery went, whether there were any complications or any events in between and things like that. And then also you'll be talking regarding the recovery period, the expected recovery period, or what to expect during the recovery period. Okay, and then you will be explaining regarding the time taken for the recovery period, okay, how long it will take for your recovery period, and you'll be giving some dietary guidelines to the patient, also remind the patient when to seek the medical help, like what when something goes wrong or what goes wrong you need to take the medical care ennulla കാര്യങ്ങളൊക്കെ പറഞ്ഞു കൊടുക്കുന്നു. Then post operative കെയറും എന്നൊക്കെയാണ് ഡിസ്ചാർജ് ഡീറ്റെയിൽസും പോസ്റ്റ് ഓപ്പറേറ്റീവ് കെയറിൽ ശ്രദ്ധിക്കേണ്ട പോയിന്റ്സുകളും അങ്ങനത്തെ കുറച്ച് കാര്യങ്ങളൊക്കെ ആയിട്ട് പറഞ്ഞു കൊടുക്കും. സോ ദിസ് ഈസ് കൈൻഡ് ഓഫ് ലൈക്ക് എ കോമൺ പാറ്റേൺ. ഇപ്പം ഞാൻ ഈ പറഞ്ഞ ടാസ്കുകളൊക്കെയാണ് നമ്മുടെ ഈ ഒരു ടാസ്കിൽ എൻറ്റയർലി ഒരു കാർഡിൽ വരുന്ന പോയിന്റ്സ്. ഇതൊക്കെയാണ് നമ്മുടെ ഒരു പാറ്റേൺ. സോ വെൻ യു ലുക്ക് ഇൻ ടു ഇറ്റ്, ദിസ് പാറ്റേൺ ഇസ് നോട്ട് അൺഫെമിലിയർ ഫോർ യു ഗൈസ്, റൈറ്റ്? ഐ എം പ്രിറ്റി ഷ്യൂർ all of you might have at least done 5 type of cards in this kind of context. ഈ ഒരു കോണ്ടെക്സ്റ്റിലെ 5 തരം കാർഡുകൾ നിങ്ങൾ എന്തായാലും ചെയ്തിട്ടുണ്ടാവും. ഐ എം പ്രിറ്റി ഷ്യൂർ ബിക്കോസ് ദ കോണ്ടെക്സ്റ്റ് ഇസ് സെയിം. അസുഖങ്ങൾ മാറാം, സംസാരിക്കുന്ന വ്യക്തികൾ മാറാം, ചിലപ്പോൾ അതിൽ തന്നിട്ടുള്ള റിക്കവറി ടൈം മാറാം, അങ്ങനത്തെ കാര്യങ്ങളൊക്കെ മാറിയിട്ടുണ്ടാവാം. ബട്ട് സ്റ്റിൽ ദ പാറ്റേൺ നിങ്ങൾ നോക്കുകയാണെങ്കിൽ അതിൻ്റെ ഒരു സ്ട്രാറ്റജി പാറ്റേൺ സിമിലർ ആയിരിക്കും. ഓക്കെ, സോ എനിവേസ് ലെറ്റ്സ് പ്രാക്ടീസ് ഇറ്റ് ബിക്കോസ് ആസ് ഐ ടോൾഡ് യു വി ആർ സീയിങ് എ recurrent trend of using the similar patterns for the past couple of months. So let's try practicing that the same. So I'll be sharing the card right now, and remember you'll have 3 minutes to go through the card, look at it, read through the entire thing, understand, okay, this is the point, these are the things I need to prepare, and after that we'll have a detailed discussion of it. Okay, so make sure that you're preparing well in it. So yes, good evening all of you. Yes, Suma, good evening. Jubi, good evening. Yes, Suma, glad to see you again in the live session as well. Yes, Limna, Ardra, yes, GB, Nasia, Suma. Okay, I'm very happy to see all the people from my speaking club also into the live segment. Really happy to see you guys here. So without wasting much time, let's get started with the segment. So I'll share the card right now. Remember, you have 3 minutes to prepare it, okay? Yeah. Okay, welcome back everyone. So I hope all of you have gone through the card, got an idea about how this can be done, and as I mentioned, I'm pretty sure that you got a picture about how this common card can be done because the context is same, the entire pattern that is very familiar to you. So I hope it is going to be very easy for you to give me the answers whenever I raise some questions. So now, okay, let me ask you a couple of questions. So make sure that you are replying to me via comment section because as I always say, that's the only mode of communication between you guys and me. So make sure that you actively participate in the live session through the comment session. So yes, now tell me which context is this. Of course, it is pretty much easy to understand what type of context we're dealing with here. So what do you think? Is it going to be a known case or an unknown case? I know that's a very silly question to ask in this context, but still, let's actually start from the basics. So yes, tell me in the comment section what do you think is the context here. Is it going to be a known case or is it an unknown case? Yes. Yes, Danyarun, good evening. Please comment. It's a very easy question. I'm pretty sure all of you might be knowing the answer for that. So yes, what do you think is this context? Okay, Juby has mentioned this is the second category non-case. Okay, so she has also answered the next question I was about to ask you. So she has mentioned this is a non-case. Not just that, this is a second category non-case. Okay, now Juby, I want you to read the background information one more time and tell me where did you see the information that tells you this is a second category non-case. Yes, Suma, it's a non-case. Now tell me which category it is. Jubi, are you sure it is the second category? Because second category is a context where you might have previous conversations with this patient. So can you see anywhere it is mentioned you might have had any previous conversations? Suma also mentioned this is a second category. Okay, please support your context. Please tell me why you think it is a second category non-case. Which portion in the background details tell you this is and non-case which is second category. Okay, parne. Others also please comment. Limna, Danya, yes. Nazia, GB, Ardra, yes. Yes, Hannah, good evening. Tell me, do you think it is the first category non-case or second category? So as I wait for you guys to comment, let me just give an overview about what is first category and second category very quick. Okay, so for those who don't know, non-case means we have the data of the patient, and first category non-case means it's the first time we are talking to that patient. Maybe the patient was admitted in the hospital or not. Yes, the patient is there, the data of the patient is with the hospital, but you have not spoken to this patient before. You know the details. You know this is Mr. Henry. You know Mr. Henry has this problem, but nowhere it is mentioned you have spoken to him before. So that makes it the first time conversation you're having with Henry, isn't it? But when it is the second time conversation, say for example it is given, it is your patient or you have been taking care of this patient, the patient was under your care or the patient was just examined. If you see any of these information in non-case setting, that means this is your patient. You might have had previous conversations with this patient. So that makes it the second category. So now with this understanding, tell me which one do you think is the right one? Yes, Priyanka, Limna, right? It is the non-case. Yes, Liji, good evening. Suma has changed her answer to it's the first category. The nurse need to introduce herself. Yes, this is the first category non-case. Never get confused with it, okay? Just keep your facts straight. Understand the context clearly. The first category means we know the patient. Of course, it's a non-case, so we know the patient. But when I say we know the patient, it's not that you know the patient personally. Okay, say for example, there is a nurse, let's call the nurse A, and there is another nurse which is B. So nurse A and nurse B. So imagine nurse A was on duty, okay, and nurse B is doing the second shift. In the first shift, while nurse A was on duty, I walked in as a patient. And I spoke with nurse A. She got my details because when I came in, I was an unknown case. Okay, so she spoke to me. She got my details. She understood what is wrong with me. And she recommended to consult the doctor. And the doctor told me to take an observation, etc., etc. Okay, so I am currently under observation. Just imagine the context like that. After a few hours, Okay, imagine nurse A's duty time is over and nurse B walks in. So what will happen there? Nurse A will hand over all the details, including mine, to nurse B because it is her responsibility to look after all the patients Now, nurse B got my name, got what is wrong with me. She would know what is the next step that she has to do with me, maybe like an observation, check my vitals and things like that. So she knows me apparently, isn't it? But I have not spoken to nurse A, and nurse A, even though she knows my name, she hasn't spoken to me as well. Okay, so this is the context you need to understand. So when nurse B comes to me and she tells me, hi, I am nurse B, I'll be taking care of you today. Yes, she has to tell me that because that's the first time she's talking to me. Then what she can do is she can verify my name. Are you Miss Richer? And then she can ask questions like, okay, I can see that you have been diagnosed with this problem and you've been under observation for 2 hours right now, and then carry on with the conversation. So what she did is she introduced herself and she verified my details, and then she carried on with the conversation because I'm a non-case, but it's the first time we are talking. This is called first category. Now, let's rewind a little bit. Just imagine nurse A's duty time is not over. She's still working and I'm under observation. There is no nurse B in the picture, okay? Just eliminate nurse B from there. Now, nurse A, when I came to the hospital, she received me. I consulted the doctor. Now I'm under observation. So nurse A told me, okay, go take some rest. I'll be coming back after 2 hours to check on you. So imagine after 2 hours, nurse A came back again. So now she knows me and I know her because this is the nurse that I spoke to a little bit earlier. That makes me a non-case to her. Already I'm a non-case, but that makes me like I'm not at all unfamiliar to her. She knows my name, she knows my problems, and I know who she is and I know what she's going to do with me. So that makes it like the second category non-case. So that means she doesn't have to come and tell me again, hi, my name is nurse A, I'll be taking care of you in the because she just mentioned that when I came to the hospital. So when she is coming back again, she can simply say, hi, yes, Miss Richa, how are you doing right now? She can simply directly start with it. She doesn't need to do the self-introduction by saying that who I am, this is what I do, I'll be taking care of you. Okay, so this is the basic difference between first category non-case and the second category non-case. I hope you guys got a picture about it. So if there is any clarity issues, if you need any further explanations or any clarifications to be made, make sure you let me know in the comment section. And if it is clear, give me a thumbs up, okay, so that I'll understand that you are following what I'm saying. Okay, so Limna mentioned it's the first category. Juby said, yes, I was wrong. Here it is not given any hint like it's a second time conversation, so it's a first category. Good. Okay, good. So then he also mentioned this is a non-case. Okay, so I am very happy to know that you guys understood, okay, this is not there, so I made a mistake. This is the right context. So always remember, you get the facts straight. You need to get the facts right, because when you are having a wrong start, that might affect your entire presentation and you might lose out on your confidence, which is not a good thing, which actually can bring down your entire performance to a very low profile. So you won't be able to perform well, you might not be able to speak confidently, you'll be constantly making mistakes, you'll be constantly thinking about, oh, I messed up my intro. Do not let this happen to you. Do not take it, your confidence away from you. So make sure that you are very much confident in it and you plan your introduction well. And it is important that you are very much clear with the context that is given there. You do not need to take much time to understand, okay, this is given there, this is given here, so this is this context. It should be that easy. Okay, so that is how it needs to be done. Okay, yes, all right. So I hope all are clear with this. Yes, Juby is clear. Priyanka, it's clear. Okay, so it's clear. Good, good, good. Okay, so now let's get into this business. Let's start with the explanation here. So this is the first category. We know the patient because the patient is in ward. So obviously the patient's data is available at the hospital. So we know the patient. Let's call the patient Henry. So what we can do is we can start the conversation either by calling out Mr. Henry's name. Hi, good evening, Mr. Henry. This is doable, okay? Or you can simply greet by saying, hi, good evening. Don't call out the name. Both are fine. Then, definitely, since it's the first time conversation, you will be introducing who you are. Hi, good evening, Mr. Henry. My name is Richa and I work as a registered nurse in the surgical ward. And then you will say, I am here, and you will explain the reason for the visit, which is your task number 1. You can see that there. Okay. Now, if you're not calling out the name of the patient, or if you're just greeting the patient, hi, good evening, what you have to do is, after that greeting, you have to say who you are. Hi, good evening, I'm Richa, I'm a registered nurse working in the surgical ward. Then you need to verify the patient details. Okay, so either what you can do is, after you say who you are, you can tell the reason for your visit. I am here to check on your progress and discuss the aftercare with you. So could you please verify your name and age for me? എന്ന് വേണമെങ്കിൽ അവിടെ പറയാം. അല്ലെങ്കിൽ you can swap it too. You can first tell the patient, this is the reason why I'm here and this, or you can do one thing, you can verify the details and tell the patient, okay, hi Mr. Henry, so I'm here to do this. It's absolutely fine. It's not like first this is the step and this is the step. You don't have to be overly concerned about just following that like that. Okay, do not memorize it. Just remember, this is the logical explanation, this is the logical structure I need to follow here. So this is actually not affecting my flow of conversation. And if it is not affecting a flow of conversation, and if you're including every point there, it is absolutely fine. You do not have to be memorizing everything and reciprocating as you listen to some people telling you this is it, this is it, this is how you have to do it. It's not speaking. Speaking is creative. Okay, there are certain restrictions that you have to keep in mind because it's a professional setting. So you cannot use some, big jargons, and at the same time you cannot use the slang kind of attitude and all. And also when it comes to the context, the reference of the context has to be the same. That is important. Okay, you cannot talk to a non-case patient like you're dealing with an unknown case patient. So that understanding has to be followed. So the sentences, the structure or the steps involved in your introduction, you can play around with it as and when like you feel, and you need to be thorough and sure that it's not affecting the flow of conversation. That's the only thing you have to keep in mind. Just remember that. Okay, നിങ്ങൾ ഇപ്പോൾ ആദ്യം വെരിഫൈ ചെയ്തു, അങ്ങനെ ചെയ്തു, ഇങ്ങനെ ചെയ്തു, that's absolutely okay. Alright, ഇനിയിപ്പോൾ നിങ്ങൾക്ക് ഗ്രീറ്റിംഗ് ചെയ്യുന്നതിന് മുന്നേ വെരിഫൈ ചെയ്യണോ? ചെയ്തോ, no problem. You can say, hello, can you please verify your name for me? അല്ലെങ്കിൽ you can say, hello, are you Mr. David? Okay, she is saying, yes, I'm Mr. David. Or I'm David. So what you can say is, well, hello Mr. David, I'm Richa, I'm a registered nurse working here. Good evening, how are you doing today? Simple as that. You can do it absolutely fine. Okay, so make sure that you have this thing in your mind. It has to be like properly organized, but whatever steps that you're going to plan, just write it down on the side of the material so that you will not get stuck, or you will not stammer, you will not go blank while you're speaking. Because I have personally seen a lot of students who kind of like they go blank when I say your time starts now. Okay, because they'll be preparing really well, they'll be looking at the context, they'll be planning everything, they'll be like, okay, I have to say like this. Their role play card looks very beautiful. Okay, they will be doodling everything and all of things all over the page. But when I say your 5 minutes starts now, you can speak right now or anything like that, they go blank. Okay, and when you go blank, you might not be able to remember what you have planned. You might even forget the basic introduction you have been doing for the past 2 months or 3 months or 4 months or for 1 year for that matter. It happens. It clearly happens. So what you have to do is, even if you're 100% sure about this is introduction, I cannot make any mistake, atra confident aanengilum, make sure that you note it down somewhere, because it is important that you are not breaking up in the intro phase, so that your confidence level will be still high and you will not come down. So it is important that you do that. Okay, so yes, having said that, I know I have given a lot of information right now. Now let's get into the business, let's get into the task constructions and see how each task can be done. Okay, so let me give an overall intro part here, but before I say mine, I can see there is one sentence in the comment section, so let me read that. Suma Yadav has mentioned, good evening Henry, I am nurse Suma working in the surgical ward. Okay, so I won't recommend you to say, hi, I am nurse Suma. That sounds little artificial. So what you can do is, it sounds a little unnatural. Okay, so what you can say is, hi, I am Suma, I work as a nurse, would be better, or I'm a registered nurse, like the usual sentence. Okay, if you don't want to say I'm the registered nurse, you can say I work as a nurse in this hospital, I'll be taking care of you. That's absolutely fine and okay, but I'm nurse Suma is not natural. Okay, so let's change that. You are looking after nurse for today. That is also wrong, dear. We don't say you are looking after nurse for today. I will be looking after you today is the right thing. Okay, I will be looking after you today is the right way of executing that statement. And how are you feeling today is excellent. Yeah, good to go. Yeah, you can plan that. Okay, now let me show you my introduction. Okay, so I decided to verify the patient details in the role play, but for that I will be structuring it in a way I'll be showing you, so you can follow that, or if you can, if you have any other full introduction that you think is suitable for this context, let me know in the comment section, like Suma did, so others can also see it. And if it is wrong, you can get the correction also, so that you don't have to learn the wrong things. Okay, so look at the introduction here. Hi, good evening. I am Richa. I'm one of the registered nurses working in the surgical ward. Could you please verify your details to me? Hello, Mr. Henry. So I hope you're doing fine. So let me tell you why I'm here. Well, I'm here to check on your progress and also to discuss your aftercare with you. So before we start, I would like to know how you have been feeling. Do you experience any pain or any discomforts like nausea or anything that I need to know about? So this is the intro part that I'm going to say. Okay, so I hope you got an idea about it. This can be done in a very simple way also. You can say like, hi, good evening, my name is Richa. I'm one of the registered nurses working in the surgery ward. Can you please verify your details to me? Hello, Henry. I'm here as advised by the doctor to check on your progress and also to discuss the aftercare with you. So I would like to ask you a couple of questions. How are you feeling, Mr. Henry? Do you experience any pain? Okay, do you feel nauseous or anything like that? This is also fine. This method is also fine. The first one which I did is also fine. Just incorporate all these information so that you're not missing out on anything. So you will get a good introduction there. Okay, yes, Renju, good evening. Very happy to see you again. So Juby, hello, Mr. Henry. My name is Juby, and I'm your attending nurse on duty today. Good. How have you been feeling now? Excellent. So when you do that point, you have to notice that your second segment is also asking how the patient is feeling, any pain or nausea. So if you decided to ask the patient how have you been feeling now, remember to add the points any pain or nausea along with that. And once you get a response to it, you can give the initial assurance and then move on to explain the reason for your visit. I'm going to say that absolutely okay, no problem at all. Yes, Srikumar, it is a non-case. Very good. Now, I hope that everything is clear so far. So let's look into the second task, reassure the patient about the surgery. So when the patient is asked the question, do you have any pain or do you feel nauseous? The patient said, yes, I do experience a slight pain, and after the surgery, I was feeling a little nauseous. This is what the patient said. So you're going to reassure the patient. So what you need is an acknowledgement statement. I can say, Mr. Henry, I can totally understand you've been experiencing some difficulties post-surgery. The pain that you're experiencing, the nauseous feeling, I can relate to it. Or, I can understand that these are the common side effects. Please don't worry about it. And then you're going to say, well, if it gives you any peace of mind, let me reassure you that the surgery went well and there were no complications at all. So let me tell you what to expect during your recovery period. So you told me that you've been experiencing some pain. This is quite common and natural after this surgery. You might feel a little tired, and also there is a possibility you might experience shoulder discomfort from the gases during surgery. And now in this portion, if you want, you can explain something in extra. Okay, so if you want, the patient might not be knowing anything about what gases and why am I getting this shoulder pain because of the gases. So what you can say is, during the surgery, for good visibility, the doctor fill your abdomen with carbon dioxide, and after the procedure, not the entire thing will be gone, so some of the gas will be trapped inside your body. So that is the reason why you experience the discomfort over your shoulders, but don't worry, it will subside very soon. If you want, you can give the state here. If not, absolutely fine. നിങ്ങൾക്കത് പറയാൻ അറിയില്ല എന്നുണ്ടെന്നുണ്ടെങ്കിൽ ഇത് പറയാത്തത് കൊണ്ട് സ്കോർ പോകുമെന്നില്ല. But if you want to make sure that okay, your explanation is very detailed, and some people, they talk really fast. Okay, so they will finish their role play within 3 minutes 45 seconds or 4 minutes for that matter, and they will be having 1 minute or 1.5 minutes extra to speak. So if you are such a person, I would tell you this is something that you can incorporate to give more details. Okay, taskകൾ മാത്രം to the point ആയി ചെയ്തു പോയാൽ you will get excess time. So what you can try to incorporate is to expand certain points that you are very sure about and very thorough about. Remember, this is not a test of your professional knowledge. This is going to assess your English proficiency. So don't overgo with it. Okay, too much of anything can be actually bad. So make sure that what you do is you speak about certain things, or you expand certain bullet points in which portion that you're very thorough about. Say for example, sometimes you get points like keep the area clean and dry when you're talking about a wound management. So we all know why it is mentioned to keep the area, the wound clean and dry. And we also know when you have the bullet points, stay hydrated. Okay, we know that അല്ലേ. എന്തിനാണ് ഹൈഡ്രേറ്റഡ് ആയിരിക്കുക എന്ന് പറയുന്നത് നോർമലി എന്താണെന്നറിയാം. ഇപ്പോൾ ബാലൻസ്ഡ് ഡയറ്റ്, you know why it is needed, or suture removal, or coming for the regular follow-ups. So ഇതെല്ലാം എന്തിനു വേണ്ടിയാന്നുള്ളത് ആസ് എ മെഡിക്കൽ പ്രൊഫഷണൽ ഐ എം pretty sure you would all know it from your clinical experience, and if you're a fresher you would be knowing it from your very own nature of being a nurse. You would have an idea about it അല്ലേ. അപ്പോൾ അതുകൊണ്ട് തന്നെ you can just give 1 or 2 extra sentences if you are a very fast speaker. Okay, if your rate of speech goes really fast and you have excess time and you don't know what to do, you tried this, you tried that. So usually what I say is you can try teach back method, and you can try giving multiple reassurance towards the end and encourage the patient or the bystander to extend the time. But if that doesn't work for you, even after you try all these things, if your time is still excess, you can try this. You can try to expand the very simple points into 1 or 2 extra statements which you are very familiar with, which you know very well. Okay, appo angane try cheyidalum madi. Okay, so that is how we can do that particular task about the gases part. Now once you finish it, you can ask the patient, is that clear to you? I hope you understand, etc. So the patient said, yeah, that is clear to me. Now the next task is advise the patient about activities during the recovery period. So you need a transition. You need to plan like, okay, this is how I'm planning to move to my next task. So what is the transition going to be? What you can do is either you can use a connector like, okay, so moving on, I would like to give you some advice about certain activities that you need to do during your recovery period. Or you can ask a question. So do you know how to engage in your recovery period, or do you know everything about what you need to do in your recovery period? You can ask a specific question, so the patient will be like, no, I don't know, so can you explain that to me? So automatically you're getting a chance to explain. Don't worry, I'll explain certain activities that you need to keep in mind during your recovery period. And you can automatically do it. So let's see what are those points. Rest for 2 days, avoid heavy lifting for 2 to 3 weeks, and gentle walking. So here, what you can do is rest ഒരു verb, avoid ഒരു verb, gentle walking ഒരു noun phrase ആണല്ലേ. So gentle is a adjective that is used to describe the type of walking that is instructed for the dog patient. So now let's see what you can do here. അപ്പോൾ വെർബുകൾ വരുമ്പോൾ അതിനെ ഒരു ബുള്ളറ്റ് പോയിന്റിൽ നിന്ന് മാറ്റി ഒരു സെൻറ്റൻസിലേക്ക് ആക്കാനായിട്ട് the easiest method you can implement is using the word to. കേട്ടോ, അപ്പോൾ you can say it is important to take rest, or take venda. It is important to rest for 2 days and to avoid heavy lifting for 2 to 3 weeks. You can do gentle walking, or please make sure that you go for gentle walking, or you engage in gentle walking. ഇത്രയും പറയുമ്പോൾ ആ ഒരു പോയിന്റ് കഴിഞ്ഞു. Additionally, I would like to give you some dietary guidelines. കാരണം അതും എന്ത് തന്നെയാണ്, നിങ്ങൾ കൊടുക്കുന്ന സജഷൻസ് തന്നെയാണ്, അല്ലെങ്കിൽ ഇൻസ്ട്രക്ഷൻസ് തന്നെയാണ്. സോ അഡീഷണലി ഐ വുഡ് ലൈക്ക് ടു ഗിവ് യു സം ഡയറ്ററി ഗൈഡ് ലൈൻസ്. please make sure that you eat small portion. എപ്പോഴും ഈ സ്മോൾ എന്ന് കണ്ടാൽ ക്വാണ്ടിറ്റി പോർഷൻ കൺട്രോൾ ആണ് അവർ ഉദ്ദേശിക്കുന്നത് കേട്ടോ. പ്ലീസ് ഈറ്റ് എ സ്മോൾ പോർഷൻ ആൻഡ് ഇൻക്ലൂഡ് ലോ ഫാറ്റ് മീൽസ്. Totally avoid fried items, but remember to increase more fiber to prevent constipation. So it is important that you have a well balanced diet, and I personally like to repeat the same point, this point കേട്ടോ. ഇപ്പോൾ ഞാൻ പറയാൻ പോകുന്ന കാര്യം എപ്പോഴും ഇതുപോലെ ഡയറ്റിൻ്റെ കേസ് വരുമ്പോൾ എനിക്ക് പറയണമെന്ന് എനിക്ക് തന്നെ ഇങ്ങനെ വന്നുകൊണ്ടിരിക്കും. ലൈക്ക് ടെൽ ദിസ് ടു ദ സ്റ്റുഡൻസ്, ഇത് പറയാനായിട്ട് പറയുക. I have to say that. Okay, so if you are a constant viewer of my live and the speaking club, you are very familiar with this context. If you have not listened, listen this time. So whenever you advise a patient to eat good food, like diet suggestions kodukumbo, it is good that it will be also good if you add the point of, don't worry, the dietitian will meet you. He will help you to plan a proper diet based on your preferences and which is good for your health. എന്നുള്ള രീതിയിൽ നമുക്കൊരു ഡയറ്റീഷ്യൻ്റെ കാര്യം കൂടെ അവിടെ വേണമെങ്കിൽ ആഡ് ചെയ്യാം, ഈവൻ ഇഫ് ഇറ്റ് ഇസ് നോട്ട് മെൻഷൻഡ് ഓൺ യുവർ കാർഡ് കേട്ടോ. ഈ ഒരു കാര്യം നല്ലതാണ്. നമ്മളെപ്പോഴും നല്ല ഡയറ്റ് കഴിക്കണം, ഇന്ന ഫുഡ് അവോയ്ഡ് ചെയ്യൂ എന്നൊക്കെ പറയുമ്പോഴേക്കും യു ക്യാൻ സേ പ്ലീസ് ഡോണ്ട് വറി അബൌട്ട് ഇറ്റ് മിസ്റ്റർ ഹെൻറി. ദ ഹോസ്പിറ്റൽ ഡയറ്റീഷ്യൻ വിൽ ബി മീറ്റിംഗ് യു സൂൺ ബിഫോർ യുവർ ഡിസ്ചാർജ് ടു ഡിസ്കസ് ദി ഡയറ്റ് പ്ലാൻ വിത്ത് യു, ആൻഡ് ഹി വിൽ അറേഞ്ച് എ പ്രോപ്പർ പ്ലാൻ അക്കോർഡിംഗ് ടു യുവർ കറൻറ്റ് ഹെൽത്ത് ആൻഡ് വാട്ട് ഈസ് നീഡഡ് ടു ഇംപ്രൂവ് യുവർ ഹെൽത്ത് ആൻഡ് ഓൾസോ ബേസ്ഡ് ഓൺ യുവർ പ്രിഫറൻസസ് എന്ന് പറഞ്ഞിട്ട് ആ ഒരു പോയിന്റിൽ കുറച്ച് അഡീഷണൽ ഇൻഫർമേഷൻ വന്നു. സോ ഇറ്റ് വുഡ് ബി ലൈക്ക് ബെറ്റർ. ഓക്കെ, അത് കുറച്ചുകൂടെ ബെറ്റർ ആയിട്ടുള്ളൊരു പ്രസൻറ്റേഷൻ ആയിരിക്കും. അപ്പോൾ ഡയറ്റ് വരുമ്പോൾ ഡയറ്റീഷ്യൻ ആഡ് ചെയ്യുന്ന ഒരു കാര്യം ഒരു അഡീഷണൽ പോയിൻ്റ് ആയിട്ട് കാർഡിലില്ലെങ്കിലും ചെയ്തോളൂ, നല്ലതാണ്. ഓക്കെ, നൗ വൺസ് യു ഹാവ് ഫിനിഷ്ഡ് ഇറ്റ് അഗെയിൻ യു വിൽ ബി ആസ്കിങ് ദ ക്വസ്റ്റ്യൻ, സോ ഹൗ ഡസ് ദാറ്റ് സൗണ്ട് ടു യു? എല്ലാം ഓക്കെ അല്ലേ എന്ന് ചോദിക്കുമ്പോൾ പേഷ്യൻറ്റ് സേസ് യാ ദാറ്റ് ഈസ് ഓക്കെ വിത്ത് മീ. ഓക്കെ, നൗ ദ നെക്സ്റ്റ് പോയിന്റ് ഈസ് ഔട്ട്ലൈൻ വെൻ ടു സീക്ക് ഹെൽപ്പ്. ഓക്കെ, സോ യു ക്യാൻ സേ ക്ലിയർ ആണ് എന്ന് പറയുമ്പോൾ വേണമെങ്കിൽ എന്ത് പറയാം? അങ്ങനെയാണെങ്കിൽ എന്ന് പറയാം അല്ലേ. അങ്ങനെയാണെങ്കിൽ എന്നുള്ളത് ഇംഗ്ലീഷ് എന്താ? വെൽ ഇൻ ദാറ്റ് കേസ്. ഈ വെൽ ഇൻ ദാറ്റ് കേസ് എന്നുള്ളത് ഫ്രേസ് ഞാൻ ഓഫ്ലൈൻ ക്ലാസ്സിലായിട്ടാണെങ്കിലും ക്ലബിലൊക്കെ പഠിപ്പിക്കുമ്പോൾ ഐ ഹവ് നോട്ടീസ് സം പീപ്പിൾ യൂസ് ഇറ്റ് ടുഗദർ ലൈക്ക് വെൽ ഇൻ ദാറ്റ് കേസ്. ഓക്കെ, സോ റിമെമ്പർ ഇറ്റ്സ് നോട്ട് ലൈക്ക് വെൽ ഇൻ ദാറ്റ് കേസ് എന്നൊരു ഒറ്റ ഫ്രേസ് അല്ല. വെൽ എന്ന് പറഞ്ഞൊരു ഫില്ലർ കഴിഞ്ഞ് ഒരു കോമ ഇട്ടിട്ട് ഇൻ ദാറ്റ് കേസ്. ഇൻ ദാറ്റ് കേസ് എന്നുള്ളതാണ് നമ്മളവിടെ യൂസ് ചെയ്യുന്ന ഒരു കണക്റ്റർ. അതിന് മുന്നേ ഒരു കണ്ടിന്യൂറ്റിക്ക് വേണ്ടിയിട്ട് നമ്മൾ ചുമ്മാ അല്ലെങ്കിൽ ഒരു നാച്ചുറൽ ഫില്ലർ എന്നുള്ള രീതിയിൽ വെൽ എന്നവിടെ ആഡ് ചെയ്യുന്നേ ഉള്ളൂ കേട്ടോ. അപ്പോൾ ആ വെൽ എന്ന് പറഞ്ഞതിന് ശേഷം പോസ് ഫോർ എ വെരി ഫ്രാക്ഷൻ ഓഫ് എ സെക്കൻഡ് and then continue with the rest of the portion. Okay, so you can say, well, in that case, it's something like that. Okay, so you can try to practice. Don't say well in that case angane poyirudhu. It's not like it's like no thanks ennu nammal parayna pole ato. No thanks ennalladhu namakku orumichu, that's very impolite. So what you have to do is, when you don't want something, this is out of context, but idu parane vannappo I'm just connecting with it. What you can do is, when you don't want something but you appreciate that person offering that to you, you can say no but thank you. Okay, or but parayanda thank you parnalum madiyengilum no thank you. Okay, don't say no thank you ennu orumichu parayada. Okay, that is very rude. So what you have to say is politely say no but thank you, or you can say no thank you. Adhe pole thaneyanu ivide well in that case ennalla well in that case. So aa oru karyam work out cheyato. Well in that case, I would like to talk to you about when to seek medical help. If you experience a fever, or if your pain worsens, or if there are any signs of infection, it is very important that you consult the doctor to make sure everything is all right. ഇങ്ങനെയൊക്കെ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ ഡോക്ടറെ കാണേണ്ടത് ഇമ്പോർട്ടൻ്റ് ആണ്. അവിടെ നിങ്ങൾക്ക് ആഡ് ചെയ്യാൻ പറ്റുന്ന പോയിന്റ്, make sure you see the doctor to make sure everything is all right എന്ന് പറയാം. To make sure everything is all right, or you can say to decide on the next step. അടുത്ത എന്ത് ചെയ്യണം എന്ന് തീരുമാനിക്കാനായിട്ട് ഡോക്ടറെ കാണുക എന്ന് വേണമെങ്കിലും പറയാം കേട്ടോ. സോ ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് യു കൺസൾട്ട് ദ ഡോക്ടർ ടു ഡിസൈഡ് ഓൺ വാട്ട്സ് എ നെക്സ്റ്റ് സ്റ്റെപ്പ് ടു ഡു. ഇതും ഓക്കെയാണ്. അല്ലെങ്കിൽ വാട്ട് ഇസ് എ നെക്സ്റ്റ് മാനേജ്മെൻറ്റ് എന്നൊക്കെയുള്ള രീതിയിൽ നമുക്ക് പറയാം. സോ ദാറ്റ് ഈസ് ഹൗ യു ക്യാൻ ഫിനിഷ് ഇറ്റ് ഓഫ്. സോ യു ക്യാൻ സേ ഫൈൻഡ് ഔട്ട് ഇഫ് ദ പേഷ്യൻറ്റ് ഹാസ് എനി കൺസേൺസ് ഓർ ക്വസ്റ്റ്യൻസ് അറ്റ് ദ എൻഡ് ഓഫ് ദ ടാസ്ക്, സോ വിച്ച് ഈസ് കൺസിഡേർഡ് ആസ് എ ഡിഫോൾട്ട് ട്രാൻസിഷൻ. അത് തന്നെ ഉപയോഗിച്ച് നമുക്ക് എന്ത് ചെയ്യാം, അടുത്ത ടാസ്കിലേക്ക് പോകാം കേട്ടോ. Okay, Renju has commented non-case first category. Excellent, that's right. Okay, then once you have completed that, find out if the patient has any concerns or questions. Chalpa patient endu chodikkumayirikam post operative care ne patti chodikkarikam, because your next task is talking about post operative care. Appo endu parayam? Okay, well, Mr. Henry, I understand that you have some concerns about your post operative care, especially the stitches, but please don't worry. we have given you dissolvable stitches, so it will disappear within 2 weeks of time. And we have dressed your wound, so you may need to come back in 3 to 4 days to remove the dressings, and if needed we can redress it for you. Okay, now ഇത്രയും പറഞ്ഞിട്ട് നമുക്ക് ഒന്നുകൂടെ സ്റ്റോപ്പ് ചെയ്യും. സോ ഐ ഹോപ്പ് എവറിഥിങ് ഇസ് ക്ലിയർ ടു യു. സോ ഹാവിങ് സെഡ് ദാറ്റ്, അത് പറഞ്ഞതൊക്കെ അവിടെ ഇരിക്കട്ടെ. ഐ നീഡ് ടു ആസ്ക് യു അബൌട്ട് യുവർ ഡിസ്ചാർജ് അറേഞ്ച്മെൻറ്റ്സ്. സോ ഈസ് ദർ എനിവൺ ടു അക്കംപനൈ യു ടു ഗോ ഹോം? സോ ദ പേഷ്യൻറ്റ് സേസ് ഇപ്പോൾ ഇല്ല എന്ന് പറയുകയാണെങ്കിൽ ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് ദ പേഷ്യൻറ്റ് ഹാസ് എ കെയർ അറ്റ് ഹോം ഫോർ 24 hours. അല്ല, അപ്പം എന്ത് പറയണം? വെൽ, ഇറ്റ് ഈസ് വെരി ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് ദർ ഇസ് സമ്മൺ വിത്ത് യു ഫോർ ദ നെക്സ്റ്റ് 24 hours. സോ പ്ലീസ് മേക്ക് ഷുവർ ദാറ്റ് യു ഹാവ് സമ്മൺ. ഇപ്പോൾ അവരുടെ കൂടെ ആരും ഇല്ല എന്ന് പറയുകയാണെങ്കിൽ ഓക്കെ, സോ മിസ്റ്റർ ഹെൻറി, ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് യു അറേഞ്ച് സമ്മൺ, മേ ബി എ ഫ്രണ്ട് ഓർ എ ഫാമിലി മെമ്പർ, എനി വൺ ടു അക്കംപനൈ യു ഫോർ ദ നെക്സ്റ്റ് 24 hours. സോ ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് എന്ന് പറയാം. ഇനി അങ്ങനെ ആരും ഇല്ലെങ്കിൽ വേണമെങ്കിൽ നമ്മുടെ സൈഡിൽ നിന്ന് ആരെങ്കിലും അറേഞ്ച് ചെയ്യാമെന്ന് പറഞ്ഞാലും മതി കേട്ടോ. ഇനി അതൊന്നുമല്ല, ചിലപ്പോൾ പേഷ്യൻ്റ് പറയും എൻ്റെ വൈഫുണ്ട് എന്ന് പറയുകയാണെങ്കിൽ നമ്മൾ അടുത്ത പോയിന്റ് എന്തായാലും പറയണം. Okay, I'm glad to hear that your wife is here with you, but always remember it is important that you need a person with you for the next 24 hours. We'll be also speaking to your wife about it എന്ന് പറഞ്ഞാൽ മതി കേട്ടോ. വൈഫിനോടും ഞങ്ങളത് പറഞ്ഞേക്കാം എന്ന് പറയുമ്പോൾ ആ ഒരു പോയിന്റും കഴിഞ്ഞു. So this is how you can construct statements for this whole context. Okay? So I hope it is clear. So as a conclusion, what you can do is the reward analysis. So what you can say is, well, I hope everything is clear to you. So let me just continue with, I just need to check your vitals. Even our point illa, but വേണമെങ്കിൽ നമുക്ക് എന്ത് പറയാം, I just need to check your vitals and then I'll leave and I'll be coming back later to check on you for after 2 hours. No, അങ്ങനെ എന്തെങ്കിലും പറയാം. In the meantime, if you need anything, please ring the buzzer. That is how you can wind up this conversation. Okay, or I'll be coming soon along with the doctor for the rounds and then we will discuss the discharge details with you. No, അങ്ങനെ എന്തെങ്കിലും പറയാം. Okay, so that is absolutely fine. That is how we can finish off this conversation. So I hope you got a picture about it. Yes. Okay, Dania, good evening Henry. I am Dania, one of the registered nurses working in the surgical ward. Can you please tell me your full name and age for my verification? Excellent. Okay, so very good. That's the right introduction. Okay, yeah, so all of you have given Henry. Okay, so it's Henry, Henry. Okay, good. Anyways, so I hope all of you got a picture about how this can be done. And I hope it is clear to all of you, the pattern, how the sentences can be constructed. So, ഇതൊരു ഈസി കോണ്ടെക്സ്റ്റ് ആണ്. ഈ കാർഡൊക്കെ എനിക്കറിയാം എന്ന് പറഞ്ഞ് ചെയ്ത് നോക്കാതിരിക്കരുത്. Try. See whether you can actually speak and construct statements fluently and spontaneously. നിന്ന് പോവാതെ നല്ല രീതിയിൽ അത് പറയാൻ പറ്റുന്നുണ്ടോ എന്നുള്ളൊരു കാര്യം ഉറപ്പ് വരുത്തുക ഇമ്പോർട്ടൻ്റ് ആണ് കേട്ടോ. അതുമാത്രമല്ല, ഇതുപോലത്തെ കോൺസ്റ്റൻറ്റ് കാർഡുകൾ എസ്പെഷ്യലി 28th എക്സാം എഴുതാൻ പോകുന്നവർ നിർബന്ധമായിട്ടും ഈ കാർഡുകളൊക്കെ ചെയ്ത് പ്രാക്ടീസ് ചെയ്യാം. ബിക്കോസ് ദീസ് കോമൺ പാറ്റേൺസ് ആർ റിപ്പീറ്റഡ്ലി ആസ്ക്ഡ് ഫോർ ദ എക്സാമിനേഷൻ. സോ വർക്ക് ഓൺ ദാറ്റ് ആൻഡ് സീ ദ ഡിഫറൻസ് കേട്ടോ. സോ യെസ്, ദാറ്റ്സ് ഓൾ ഫോർ ടുഡേ. ഐ ഹോപ്പ് എവറിത്തിങ് ഇസ് ക്ലിയർ. താങ്ക് യു വെരി മച്ച് ഫോർ യുവർ കോൺസ്റ്റൻറ്റ് സപ്പോർട്ട് എവറി വൺ. താങ്ക് യു ഫോർ കോമെൻറ്റിംഗ് ഡൗൺ throughout the segment. So now tomorrow we'll be having the live session wherein which we'll be having the mock presentation. അപ്പോൾ അതും എന്തായാലും എല്ലാവരും കാണാൻ ശ്രദ്ധിക്കുക. So based on which you will be given a discussion after the live after the mock as well. mock ആദ്യം പ്രസൻറ്റ് ചെയ്തിട്ട് അതിന് ശേഷം നമുക്കൊരു ഡിസ്കഷനും കൂടി ഉണ്ടാവും. So make sure that you stay till the end of the discussion to see that too. Okay, yes, so that's all guys. Thank you very much for your patience and for being with me today. I'll be talking to you guys tomorrow at the same time, 5:30 p.m. at the same place. Until then, take care. Good night all of you.